So welcome to the podcast on volunteering and the localization agenda in the context of COVID-19. Today I'm here with Sarah Harrison, and I'm going to ask her to introduce herself. So Sarah, would you tell me a bit about yourself? What is it you do, and where is it that you work?
Yes, thank you, Ia. So similar to yourself, Ia, I'm a technical advisor at the Reference Centre for Psychosocial Support in Copenhagen. And in that job, I support national societies around the world. And I also have the responsibility on behalf of the IFRC to co-chair the Interagency Standing Committee Reference Group on Mental Health and Psychosocial Support in Emergency Settings.
And what is actually what it concretely is this group doing, the Interagency Standing Committee? What is it doing on mental health and psychosocial support?
So it's a group of agencies. There's around 56 different member agencies, and membership is by agency or organization. It's not by individuals. And it's agencies that are operational, really, providing mental health and psychosocial support in emergency contexts. And emergencies is quite a broad definition here, so it covers refugee settings, migration settings, public health emergencies such as COVID-19, and armed conflict as well. And the group, their main responsibility actually is to disseminate the guidelines on mental health and psychosocial support that were written in 2007, to make sure that they are used and people follow them in emergency settings, and also to develop new guidance where necessary. So, for example, new guidance has arisen because of this pandemic, COVID-19, and also other guidance, technical guidance, for example, on monitoring and evaluation. And my role is also supporting different agencies that are based in humanitarian settings to help them improve their quality of programming for mental health and psychosocial support.
Oh wow, that sounds like quite a bit. And I was just wondering about this MHPSS group. Can anybody join? Can anybody be a member?
Yes, so as I mentioned before, membership is by organization. So, for example, if you took the IFRC, there's many people that are behind IFRC. It's a very broad organization. So we have many people that are on the list, the database, and are part of the broader membership of the reference group. But each agency only has one vote. So, for example, Save the Children or TED is Om. Or WHO, they have one vote, but there may be many colleagues at WHO who are part of the reference group. So the only kind of stipulation for membership is that your organization has to be either a UN organization that's operational in emergencies. So it tends to be like UNICEF or UNHCR, WHO, UNFPA, and International Organization for Migration, or you need to be an international NGO, operational emergencies, and doing mental health and psychosocial support programming, a Red Cross Red Crescent movement partner, or in some cases we have some large national NGOs that do a lot of programming within one country for many years. So, for example, BRAC in Bangladesh, TPO in Nepal and in Uganda, and an organization called Psychosocial Training Institute in Egypt as well.
Why is it we have to coordinate so much in any type of humanitarian setting?
I think, well, particularly, for example, if you took COVID-19, I think the coordination is actually one way to save money, if I can say that, particularly with the development of tools or new products, or, for example, if an organization is making something into an audio version. If one organization can maybe write the script, another organization can then turn it into an audio production, and maybe a third organization can then translate that into different languages. So you can get the same product disseminated in a variety of different ways, and with a more global dissemination if you can coordinate amongst members. And similarly, if you have members that are working on a similar topic, so for example, how to change child-friendly space activities, how you can do them within a restricted environment such as COVID-19 in some countries, that works if you have multiple agencies working on it as well, and it avoids duplication if there's coordination involved as well. So coordination really helps things get to scale globally, and it saves money because agencies come together to combine forces as well.
Okay, sounds very reasonable. Absolutely, I agree. Yeah. So also I wanted to ask you about the localization agenda. You hear this word.
Yeah.
What does it actually mean in practice?
So the localization agenda is both relatively new and also very old. I think people that have come from more of a development background and were working in longer term development projects, particularly those that started in like the 70s and the 80s, this is not a new concept. It's something that's very much at the forefront of development. However, in 2016, when there was the World Humanitarian Summit, there was something called the Grand Bargain. And within that Grand Bargain, there was an agreement by international donor governments and also governments receiving money and the humanitarian community saying that actually we need to push humanitarian aid and emergency response down to the local level. We need to empower local communities, local governments, also national governments to be able to take a stronger lead in emergencies rather than it being dependent upon external actors or internationals flying in. So it's this mixture between being as local as possible and then having an international backup or support where necessary as well so that people don't feel abandoned.
But that sounds just like the Red Cross Red Crescent, just like they would fit into the way that we work as a major organization, doesn't it?
Yes, I think that's actually the key, or one of the key advantages of the Red Cross Red Crescent movement is that with the millions of volunteers that we have globally and the thousands of branch offices, they are as local as you can possibly get. And the understanding of what it means to be someone that works in emergencies as a first responder is quite different in the Red Cross because your first responder is your neighbor. It's the man who runs a shop down the road or the lady who has a handicraft business that you know. It's your local community who are your first responders. And this is actually the truest reflection of the reality of how things are in an emergency. So when there's a big earthquake or a conflict or a pandemic like this, it is your local neighbor that will support you first. And then you might have the international actors coming in a few days later to do assessments and surveying. But your first at least your first 2 or 3 days, it's your immediate community that helps you. And that means that our volunteers are in the perfect position because they're already there and know the community so well.
So they should actually be proud that they're part of this localization agenda. So they're taking part in the bigger picture. They're doing
very
something very useful from the local perspective, but all the way up to the global.
Yes, and I think actually the Red Cross volunteers should be enormously proud because what other agencies are trying to do is actually mimic what we already have in the Red Cross Red Crescent movement. They're trying to be local, whereas we are already local by definition, by how we operate. Yeah. And that puts us as an added advantage.
So let me talk about volunteering because there are other aspects to volunteering. And actually there seems to be strong evidence that volunteers help themselves when they're helping others. And that they're also mentally protected because they're engaged in very meaningful activities. And this gives them a sense of fulfillment that also strengthens them and gives them some resilience in the face of adversity. And is this something that you have recognized from your field visits?
Yes, I think that's very true. I think it's a very natural human reaction. Most people, if they're in a crisis situation, want to be able to help. They want to help to get themselves out of it, but they also want to help somebody else who they visibly see suffering, particularly if they have the skills and the knowledge to respond. So it is an enormous protective factor. It's very much part of empowerment and being involved in emergency response efforts, both because it means that the efforts are correct, they're culturally appropriate, but also it means that the volunteers themselves are protected because they're actively contributing to getting themselves out of the emergency or to helping their community rebuild after an emergency. But I think the flip side of this, and this is where we need to have the balance right, is for volunteers to not feel so overwhelmed or so stressed in what they do. There's a lot of responsibility being the volunteer in a particular community and being the first person to respond. There's a bit of a burden. So there's also a self-protection issue in terms of self-care that volunteers also need to be aware of and know when things might be getting too much and they need to be able to speak up and say, look, I can't manage or I need to take a break for something as well. So it's a fine line. I think it's a fine balance. There is a lot of protection in being part of response, but it can also be too much and you can sometimes feel overwhelmed.
Yeah, yeah, very true, very true, very good points. But let me also ask you, do you see other advantages that the Red Cross Red Crescent has to compare to other organizations? You've talked about some of them, the localization, we're
Yeah.
there. Some even say we're the first to arrive and the last to leave, and you could say we are there and we never leave. But anyway, do you see other advantages?
Yes, I think particularly the fact that the volunteers very much come from the communities affected means that they can do the longer term accompaniment factor.
That's a good
So
point, yeah.
somebody does not need, I mean, you might come in and say that you have a program for 6 months to support a community after a natural disaster, say, and after 6 months you might then leave. Whereas in the Red Cross Red Crescent movement, you continue living in that community. You're with them long term. You're with them through the great times in the community, the celebrations, the Ramadan festivals or the marriages that happen in the community, the fun things, as well as through the bad times. So as well as when there is a house fire or a flood or a virus outbreak that happens. So that longer term accompaniment means that you know the community much better, our volunteers do, and you're there in the good times and the bad times as well. So you're, I think, a more trusted partner. And I think secondly, with the Red Cross Red Crescent movement, it's the type of work that they do on behalf of their governments mean that they cover a broad range of ages. So we don't only focus on children, for example, or only focus on women, which is how some organizations operate. They have prioritized these particular population groups. In the Red Cross, that's not really the case. The prioritization is on a very humanitarian perspective. It's on the basis of need. So it's from a perspective of humanity. So we will equally work with someone who's 90 years old as we would with an infant child that's just been born, and everybody in between as well. So it's more of a lifespan, life course perspective that we can take.
Now, actually, that made me very proud to be part of the movement too, to hear you say all this. And honestly, I think it's very true. So I think this is a wonderful way to put a full stop to this interview. So Sarah Harrison, thank you very much for taking part in this interview for the podcast on volunteering and the localization agenda. It was really enlightening. So thank you very much.
Welcome. Thank you as well for the invitation.
Yeah, bye.
Bye-bye.